Well, good morning and welcome to this presentation. In her book, Mackenzie, 2008, quotes the words of Peter Satmari, who stated, "Greater understanding of disruptions and perplexing behaviors in children with autism is possible once we can see the world through the child's eyes." He went on, "The most important ingredient associated with successful outcome is having a family or teacher understand what it's like to be inside the mind of a child with autism spectrum disorder." Well, what a fascinating and insightful video. And I hope that gave a great insight into what it's like to be in the shoes of a child with ASD. Well, welcome to my presentation. My name is Jacob Heinrich, and today I'll be presenting on how we can think about shaping education for students with ASD through the helpful framework of the Universal Design for Learning. Now, UDL's mission is to provide a framework to improve and optimize teaching and learning for all people based on scientific insights into how humans learn. But we'll touch more on this later on. To effectively teach and manage a classroom that includes students with ASD, it's important to have a firm understanding on what ASD entails. ASD is a complex neurodevelopmental condition that affects how individuals perceive the world and interact with others. The American Psychiatric Association, or APA, defines ASD as a lifelong developmental disorder whose primary features are social communication deficits, restricted, repetitive, and stereotyped patterns of activities, interests, and sensory activities. The Australian Institute of Health and Welfare provides some helpful information regarding the most prevalent symptoms that might be experienced. These include difficulties in social interaction, restricted or repetitive patterns of behavior, and impaired communication skills and sensory activities. And now we can see some overlaps in those definitions. But helpfully, Mackenzie 2008 helpfully synthesizes these two definitions into a triad of social, behavioral, and communicative features that make up the hallmarks of autism. Let's have a look at some of the examples of each. For social, children with ASD may have trouble understanding social cues. They may have trouble interpreting social norms, maintaining friendships, and they might have a limited understanding of others' emotions or perspective. They may also use language in unusual ways, such as repeating what other people say, also known as echolalia. For communicative, people with ASD may have difficulties understanding and using verbal and non-verbal communication, and they may have a limited use of facial expression. And finally, for behavioral, individuals with ASD may have restricted and repetitive behaviors, such as hand flapping, rocking, or repeating phases, as we touched on just before. They may have a strong attachment to specific routines, and they may become distressed when these routines are disrupted. They may have an intense interest in specific topics, and they may have sensory sensitivities. So they might be hypersensitive to light, to sounds, to textures, or to tastes. Let's have a look at the prevalence of ASD to have a deeper understanding of this disorder. Now, from the AIHW in 2017, they conducted a study and a survey, and this is what they found. They found that ASD is most commonly identified in children and young people, and in fact, 83% of those diagnosed are under age 25. Now, in their study and in their survey, they found that it's most prevalent among children aged 5 to 14, and they found that in 2009, 2012, and again in 2015, reflecting the general increase in diagnosis for school-aged children. What we really need to see here is the prevalence of school-aged children with ASD is actually increasing. And this just paints a picture that the need for support and evidence for those students is very clear and very evident. And it also highlights the importance for schools and educators, such as teachers. It emphasizes the emphasis on being properly informed, resourced, and trained in able to effectively teach those students. Let's quickly have a look at the different levels of ASD because this ties specifically into the needs of children with ASD. Now, these levels are characterized by a wide range of symptoms and levels of severity. The Diagnostic and Statistical Manual, or DSM-5, from the APA actually categorizes ASD into 3 levels. And these levels represent the amount of support an individual with ASD requires. So level 1 requires some support. These individuals might need support to communicate, interact, and manage daily activities. They can often exhibit noticeable impairments in verbal and non-verbal communication skills, and they might show behaviors and difficulty with changes in routine. Level 2 requires much more substantial support. So this is support in communicating, interacting, and managing daily activities. That support is increased. And here, when routines are disrupted, they may become very distressed or uncomfortable. Finally, level 3, this is when the individual requires substantial support. Here, the individual may have severe impairments in communication, social interaction, or behavior. This can include them being of limited speech or actually being non-verbal. Here, changes to daily routines can bring about extreme distress, and they often require intensive and constant support across most areas of daily life. Moving on to the needs of children with ASD. With those levels in mind, let's consider some of the specific physical, emotional, and social and educational needs of children with ASD. Here we'll start to think about what are the needs of these children, particularly in a school environment setting. In our top row, we can see some of the academia and research that has been published to support these needs, and the bottom row outlines some of the suggested needs for children with ASD. Firstly, under the physical realm, the AIHW noted that 73% of individuals with ASD always or sometimes needed help or supervision for self-care. This can include washing oneself, dressing, eating, going to the toilet. They also need assistance with sensory sensitivities, as, for example, noise may impact a student's ability to cope within educational settings. And these coping behaviors are all often misinterpreted by their peers or actually by staff members as well. Under emotional and social, 91% always or sometimes needed help or supervision with interpersonal interactions and relationships. That's from the AIHW. Further, Kai and Richdale in 2016 noted that individuals with ASD will have social communication difficulties, which we've already touched on a little bit. They found that people with ASD have a tendency to interpret others literally, and in a classroom context, this can affect students' interpretation of teachers' instructions, which can lead to misunderstandings. It can also negatively impact teacher-student relationships, their peer relationships, and student learning outcomes. And when this happens, it definitely increases the level of stress for that student. They also noted that students with ASD often experience communication difficulties, but don't wish to draw attention on themselves to appear different from other students. Finally, in our educational realm, it was noted that 90% of those with ASD aged 5+ needed help or supervision with education. Again, we're seeing troubles with sensory sensitivities as well within an educational context. And further, a study by Klinger et al. In 2007 found that there's cognitive impairments as well. So there's individuals with ASD often have difficulties disengaging and shifting their attention. So they might get stuck on a particular object or topic and they find it difficult to refocus back in. They may also have trouble understanding that other people can have a different perspective to themselves. So what does this look like practically for needs? For physical, when we're talking about sensory sensitivities and needing help doing basic things and having a structured routine, the real suggestions that are in place should be a structured routine is very important. Having a safe space physically for them to be in, and having a sensory friendly environment, which can definitely include being a safe space. That adds to being a safe space. For emotional and social, having an inclusive and supportive environment is key. Individuals with ASD will often also need assistance understanding social situations. And within the classroom or an educational context, again, an inclusive environment is key. They may often need extra personnel support, such as a teacher's aide or someone else in the classroom with them. And they may also need differentiated instruction from the teacher to help with those misunderstandings that might occur. Now that we've considered the needs, let's look at some learning and teaching and classroom management strategies that as teachers, we can keep in our arsenal in order to greatly assist and support our students with ASD. It's important when thinking about teaching and learning and classroom management strategies that they align with the UDL framework. Remember, when we're talking about this framework, this is really just focusing in on making teaching and learning accessible and inclusive for all students, whilst recognizing that each student has their own unique strengths, needs, and ways of learning. Here on screen are the 3 areas in the UDL framework, and these guidelines help to ensure that all learners can access and participate in meaningful, challenging learning opportunities. Let's focus in on the first one, providing multiple means of engagement. Within this segment, I want to focus in specifically on optimizing individual choice and autonomy. In behavioral features of individuals with ASD that we looked at before, we saw a tendency for them to have an intense interest in specific topics. Now, this is something that teachers can use as leverage as an effective teaching and learning strategy. By optimizing individual choice and autonomy in classroom tasks or assessments, this will help students with ASD to choose something that they're interested in and are able to focus and stay engaged in. This is also an example of effective differentiation. For example, if you had an assessment such as an essay where you're testing for writing skills, you can let them choose a topic that they're interested in rather than having one set topic. Now, the success of this may vary on the ability and the needs of the student with ASD, but by optimizing individual choice and autonomy, this will allow the student to select something that interests them and better captures their engagement, whilst also hitting the learning outcomes. Hence, autonomy and individual choice is a critical teaching and learning strategy, particularly for students with ASD. A second point I want to highlight in this segment is providing options for self-regulation. Now, we've seen in the video at the start of this presentation and through the discussion of needs that individuals with ASD often struggle to regulate themselves and their own emotions. Facilitating personal coping skills and strategies within the classroom context is important, and this may happen in a variety of ways. For example, having safe spaces. One way that I've seen this work effectively before in a classroom setting is the use of a calm corner, where students who become overwhelmed can go to a separate place, still within the classroom, to have a chance to calm down and regulate their emotions. They also had small objects that they can fidget with to help this process. And this still enables them to participate within the classroom and the activities that are going on in an active or just a more passive way. This can also help with sensory sensitivities and overwhelm. Another way to promote self-regulation in the classroom is by having structured and predictable environments. We've learnt that disruptions to routines can cause great distress among students with ASD. So having a learning environment that is structured and predictable is key to engage them in effective learning. There are a number of ways to promote this, including having a set routine in class and making this visible on a whiteboard or on a graphic on a wall. It's important to also talk about the routine by saying, this is what we're doing today, and listing the different tasks that you'll be doing. Further, minimizing sensory distractions is important, and you can do this by creating a sensory-friendly environment by reducing unnecessary stimuli, which can overwhelm students with ASD. These are some great examples of providing an effective means of engagement for students with ASD. Our second area of the UDL guidelines refers to providing multiple means of representation. As all students have unique ways of compartmentalizing information or knowledge, providing effective means of representation is key for students to learn effectively. In Mackenzie's 2008 study, she found that students with ASD often have a visual/spatial strength as a means of learning and making sense of the world. She says, to a child with autism, seeing is believing. She found that effective visual representation enables a student with ASD to readily understand, retain, and remember information. They're able to create visual experiences, and that they show sensitivity to color, line, shape, and form, and space, and the relationships among them, often noticing minute details. Our means of representation is important. So if you have students with ASD, you should strongly consider to customize the display of information and offer tangible alternatives for auditory information. In a practical classroom application of this can involve the use of multimedia for teaching content or actioning class tasks, such as utilizing videos, animations, or simulation experiences, which can help engage students who have different sensory preferences. And further, by providing written or audio or visual versions of content or activities that you're going through, this can help to accommodate the different learning styles. Finally, our last segment of the UDL guidelines incorporates providing multiple means of action and expression. And here I want to focus in on encouraging self-expression, which is very important, particularly for students with ASD who feel like their symptoms restrict them from expressing a true representation of themselves. Therefore, as a teacher, it's important to facilitate classroom activities and learning experiences that actually allow for every student to share their thoughts and perspectives. And this can be done through learning experiences such as discussions, group activities, and presentations. However, it's also important to note that students with ASD can have an impaired ability to communicate and to interact. So it's critical to support communication and social interaction for the student. A strategy to achieve this is clear and explicit communication. Here, a teacher can provide instructions, expectations, and information in a straightforward and unambiguous way, helping particularly students with ASD to receive and understand what has been said. Further, placing the student in group activities with a trusted peer will help to promote interaction and engagement, knowing that they're doing it with someone safe and someone that they trust. These two strategies will ultimately help to foster communicative and social skills for all students and assist in engaging with lessons with personal expression. Finally, to conclude, I wish to talk about the role of parents in the learning process and touch on the importance of other professionals in a cross-institutional paradigm to engage students with ASD in effective learning. Firstly, research and studies tell us that parent involvement within an educational context is critical. Particularly with students with ASD, their parents provide organizational, financial, and social support. However, don't feel like they can provide as much support in an academic setting. However, parent involvement and collaboration is quite vital to the learning process, as this can provide insight into individual needs of the child and provide consistency and predictability between home and school life. Mackenzie 2008 developed a parent survey to obtain learning preference and strength profiles of preschool and elementary school age children with ASD. as there was no standardized measures for examining learning preferences for these children. The results she found, this resulted in individualized and shaped support to effectively teach and assist the students in their learning journey. Having parental insight is also helpful in the creation and upkeep of individual education plans, or IEPs, that contain helpful data about the student. Further, parental collaboration also helps to build a consistency and a predictability between home and school life. Here we can see a consistent use of strategies that might be used at school to be used at home as well. And a consistent use of these strategies will aid children with ASD to reduce confusion and anxiety. Finally, collaborations with specialists in a cross-institutional manner will reap great benefits. Similarly to parent collaboration, if a student with ASD receives additional support from a counsellor, a psychologist, a disability support service, or some other professional, it is possible to align these strategies and interventions between these professional services with education and also the home to create an effective web of resources. Data from the Australian Institute of Health and Welfare survey indicates that 56% of young people with ASD receive extra tuition and 44% of them use a counsellor or a disability service. This indicates a great need for a cross-institutional approach, which is collaborative, to lead to more effective support and improved outcomes for students with ASD. In summary, this presentation has explored the needs of students with ASD and suggested multiple key learning and classroom management strategies through the lens of the UDL framework. Key takeaways should include that students with ASD are unique, and therefore unique strategies are required to cater for individual needs. A supportive and inclusive learning environment is critical for effective learning. Differentiated teaching and learning is a key skill for teachers to utilize for students with ASD. And a collaborative approach between carers, parents, and other professionals is vital to improve learning outcomes for these students. I hope you have enjoyed this presentation. Thank you very much for watching.